5 signs you've got a great doctor. Having a strong relationship with your primary care provider, PCP, is one of the keys to healthy living. Your PCP is the first person you may call when you're feeling under the weather. You turn to them for advice when you notice unusual changes in your mood or physical health. For most of your non-emergency health needs, they're the person you rely on. People who have an existing relationship with a PCP report having better healthcare access and experiences. It makes sense. The more familiar you are with your PCP, the better they'll be at understanding your unique medical needs. If you already have a PCP, here are 5 ways to know they're a good match. You can use this article as a checklist during your search. Sign number 1. They listen to you. The best PCPs value two-way communication. That means sitting down and having a conversation with you during visits. You should feel like your doctor really listens to you and respects what you have to say. A PCP can ask, "Tell me, in your own words, what is it that's most important to you?" That way they validate why you're there and give you space. If you're being interrupted or always feel rushed, you might not have the right fit. To help make use of the limited time in an appointment, consider bringing a list of your concerns and questions with you. Sign number 2. They ask you questions. Your PCP should be asking you specific questions to determine why you've come to the doctor now. It is recommended that doctors ask, "What about all of this worries you the most?" To better understand your symptoms, your doctor can ask follow-up questions. They should also listen carefully to your answers. For example, your PCP might ask if your pain is sharp or dull, or whether it wakes you up at night. Detailed questioning can help you and your doctor feel more confident in a diagnosis and the next steps. You can help your doctor by being as detailed as possible in your answers. Sign number 3. They show concern for your feelings. Good doctors try to understand what you're going through. Validating what you're hearing and seeing shows connection and empathy, says the Drive. Empathy, the ability to show compassion and concern for others, demonstrates that your PCP cares about you as a person. You can help your doctor by being honest about how you feel and by describing your emotions as well as your physical symptoms. That way, your PCP can get a fuller picture of how you feel. Sign number 4. They explain things in a way that makes sense to you. Healthcare can be complicated, and explanations can often be full of confusing medical terms. Look for a PCP who can break concepts down using plain language so that you understand what's happening. Don't be afraid to ask the doctor to repeat something or tell it in a different way. Asking lots of questions helps guide your doctor, who wants you to understand. Sign number 5. They include you in making decisions. A good doctor-patient relationship is a partnership where you make decisions together. Your PCP should outline your options and explain the pros and cons of each of them. Then you can discuss what works best for you in your situation. As a physician, you should acknowledge the patient and where they're at. As a patient, you should feel ownership in the final decision of what to do next. When discussing next steps, there's no bad question. Patients have to be comfortable enough to ask what's on their mind. If they're not comfortable, they're not going to follow the treatment plan. Repeating the options back to your doctor is a good way to make sure you understand them. Thank you for watching. Please like, comment, share and subscribe.